welcome back to the Care Innovation Studio, live from the Care Innovation Summit in London. We have our next guest with us. Sophie, how are you?
Hi, I'm very good, thank you, on this very sunny day in London.
Lovely. So, can you tell us who you are and what you do?
So my name's Sophie Chester-Glyn and I have several hats, but my two main ones are I'm a care provider. So we provide services in the southwest, and that ranges from everything from supported living, home care, a little bit of home care, community care, and also care homes. And really we started off supporting people with mental health needs and learning disability, autism, and recently we've started supporting people who, older people needing care home support. So we've got an array of different things that we do, mainly in the west of England. Mm-hmm.
And the other hat?
So that's one hat. The other hat is Co-Produce Care. So that's a non-profit I set up in 2019, basically out of the need I felt for people to understand social care. I didn't feel like there was enough understanding of what we did and what we're about and how hard we work. So I wanted to inform local policymakers, MPs about the work that's going on in social care. I wanted to give an opportunity for the care workforce to feed into policy change, and that was really the main mechanism that we were trying to use, is consultation. So if the Department of Health and Social Care had a consultation out, an inquiry out, and they wanted responses, we tried to get our network to do a joint consultation response, and then we found out that people weren't really that interested in consultations. They didn't really know what it was, so that's when we started the YouTube channel, and that was really about talking about social care from the perspective of people who work in the sector, people who draw from health and social care, and then it grew over the pandemic, where we were interviewing MPs, ministers. So we had people like Helen Whately, Gillian Keegan. Recently we had a Conservative MP that came on our channel. So from all sides, all sectors, we're trying to involve people to just get the message of social care and what it's about and all of the nuances out there, and that's on the YouTube channel.
Quite innovative, one might say.
One might say.
Well, being at the Care Innovation Summit, what are some really interesting innovations that are coming up for you in social care, and anywhere really? Stuff you've heard, stuff you're doing. What's innovation mean to you?
That's a really good question. I'm really glad you started with that, because that's where I have to start with. In my mind, when I'm thinking about innovation, I have to have in my mind the why factor. You know, what is social care innovation, and why are we doing it? And I think when we talk about innovation, we shouldn't talk about it without understanding what innovation means to you as an individual or an organisation. And for me, you can do a lot of innovative stuff and keep yourself busy, but that doesn't mean that you're getting positive outcomes with people who draw from health and social care. So for me, it's really keeping in focus the people who we are here to support, not necessarily doing it for profit or anything like that, but doing it for people, so make sure that they can live a better life, because that's why we're here and that's what we're doing it for. And sometimes those innovations might mean that tech means that we can then spend more time with people, talking to them, thinking about their well-being rather than writing notes. But it has to be clear in your kind of mission statement for why you're embarking on innovation, whatever that might be. So I always think that social care is the most innovative sector there is, because care workers have to problem solve all the time in different ways, because they're not dealing with widgets, they're dealing with people with personalities, people who are unpredictable, and they're constantly having to work as teams to work through those different situations, just like ambulance services might not necessarily know what they're going to when they answer a call. So I think that there's that side of innovation. And then there's the systems that support that on the ground innovation. And actually here I was listening to one of the speakers, and he talked about wouldn't it be really good, because one of the main bugbears that we have in one of our organisations is note writing, note recording, and there's different ways of doing it. You can talk to text or to your phone and things like that. It's not very accurate sometimes, thinking about accents and things like that, but and then you have to stop for a moment to actually input the data. And then he talks about, what if you had like an earpiece that would just record your conversation as you were delivering care, and then would write the notes for you and put them in the right place. So you could just deliver your care to Doris, and you could talk to her about her day, to her about how she wants to be supported, and then explain what you're doing as you're going along. Doris would be able to hear that. That's quite nice. She's getting that one-to-one personal attention. And also the systems will be picking up the care that's being delivered and typing it up and putting it in the right folder, wherever it needs to be. And I thought that was a really interesting thing, because that does solve a lot of problems. It means that you're more present in your job, and then you don't have to worry too much about the note taking. But I think there's more and more things that are coming out like that. One thing that I'm old-fashioned. I'm always going to be very sceptical about people who think that robots are going to do everything for us, because it's great, but for those providers that aren't funded by private clients, the local authorities aren't providing enough funds for us to be innovative in that way. So unless those type of funds come through, I've been hearing about robots delivering care for the last 15, 20 years, probably going to be hearing about it for the next 15 to 20 years, and I'm not going to see a robot delivering the type of care that's being described. It's very utopian, but without the funding to do it, then it's going to be very difficult to deliver.
I think the theme that's come out of the interviews that I've been doing today is that there's the sort of innovation that you're talking about, like robots and technology and the thousands of pounds one might spend on completely overhauling a system or a process. And then there's the innovation of the simple things like designing dysphasic food properly, changing the colour of something to make it easier for people to see, and like really simple things that happen. And like you said, with the teams and their problem solving every day, and the problem is, how do we keep Doris and Debbie apart for the next half an hour, because we know Doris upsets Debbie, and we just need to keep them apart for a bit. So how do we create an environment, situation that creates something like that, for example? So I think the idea that innovation has to be something massive and groundbreaking that changes the system 100%, I don't necessarily think that needs to be the case, does it really?
It doesn't, and I think the funding issue is really interesting, because I was looking at some research about some of the organisations that spend the most on innovation, and one of them is, shock horror, Amazon. And I think if you're going to spend money on innovation, you're going to grow a really good product that everybody needs. You're going to be able to use data in the way you need to use it. You're going to be able to work with partners more effectively, and you're going to be able to find out what the needs of a population that you can meet, and how you can meet them differently. So I think that within all of this, there's definitely the elephant in the room for me is, how is it going to be funded? I mean, one of my bugbears is the death by pilot, I call it. So we did a little bit of research in co-produced care with a local care association, and we were looking at different ways organisations in care are working together, and there were certain pilots that the local authority or the ICS or ICB would fund, and that was Trusted Assessors project, and then one of them was a system called Wazan, which is like a Wazan blue box, which would give you lots of kit to monitor people's baseline in their care. So, the temperature, blood pressure, when they were well, what was their profile, and then if you as a caregiver were not sure, whether they thought they looked differently, or maybe you regularly monitored them, you could use that kit to then see what the changes were, and then that can be connected to your local GP, and they can help assess them remotely. And so we've had incidences where we've used the kit, and actually the ambulance realised how poorly somebody is, and then it made sure that they came, they kind of like bumped them up the list of people that they had to see, so prioritise them and effectively save someone's life. So that type of stuff was fantastic, and we got the staff on board, we got the manager rolling it out, so everybody had training. Loads of people were supported well with that, but then the pilot ended, so the funding ended. And so we decided we'd fund it ourselves, and actually the organisation who issued it, they funded it for a while, we funded it for a while, and then we came to another obstacle, which was the GP surgery decided a lot of them didn't want to use the tech. So then if we had certain parts of the system not supporting us in the way that we're using this bit of tech, then it kind of all fell apart. So it needs to be really organised and funded, and you need the whole system to kind of like work together to deliver it. So if innovation is there, it's in the care sector, it's there to be grasped right here, right now, but it just needs to be organised.
And I suppose if, as much as you want to make a big change, if the rest of the system's not working with you, the hospital, the GP surgeries, local housing, it's a lot of these things might not work. Yeah. I wonder whether with things like pilots, whether maybe if you pilot something, I think you're piloting it because you're assuming it's going to work, and that maybe funding should be built into it. You need to say, I'm going to pilot this and I need 20 grand to do that, but then when it works, I'm going to need another 120 grand to install it for the next 5 years.
Yeah, it's true. I mean, one of the things I think people do in these pilots, they try to show the cost benefit. They try to show the outcomes and the positive outcomes it can make. But the problem is, even when you do that, and I've known local authorities who have got a tranche of money, and they're like, we have asked all the providers to give us data about the difference it's making. So they've collected all the information, they've provided the reports, they've showed the impact, but still the money isn't there. So it's just really, it's disheartening that the government isn't really focusing on supporting these type of things, supporting social care. A lot of it does go to the NHS. Quite rightly, they need to be funded, but then you're just leaving social care. You're actually losing a lot of savings that you could have if you try to give more money to social care to really scale these pilots, because we know it works. We know people take it on board. The care sector is fantastic at changing and adapting to change, whether it's technology or whether it's policy or law. We saw that in the pandemic. But it just isn't supported financially to kind of scale that kind of stuff and make it sustainable.
And you can use the hospital system for what it should be used for, which is acute care. And then the rest of the care can happen, as part of the care sector, whether that be in the home or in a care home or in some kind of step-down facility that allows that hospital bed to be given to someone who needs it, rather than Doris sitting in the hospital bed for 7 days longer than she needs to, getting ill again, or catching a infection, or just muscle atrophy and general things like that. So interesting. I've got one final question for you. Scones, jam then cream or cream then jam?
Well, first of all, we need to sort out this scone situation. It's scones, okay? In my mind, it's scones. And I'm West Country. So what would I do? Oh my gosh, you have to have the cream and like lashings and lashings of cream and then jam on top.
Yeah, like a touch of jam on top. Yeah, not just like a gentle covering. No,
No, I'm extra. I have to have a lot of everything. All the cream, all the jam.
Well, thank you very much for coming and seeing me today. It's been great to talk to you, and we'll catch up soon.
Pleasure.
Thank you. We'll be back shortly.